Good morning. We are still morning here in the UK. Good morning. We are back to the second session of day 2, and I think you may have all enjoyed, as I did myself, and I'm sure all of the feedback I have seen in the Facebook. The first session was very, very uplifting, very good start with the 3 papers we listened to from Auckland, New Zealand, and from about India, which is very interesting. 5 co-authors. Presentation took place from New Zealand. It's about India, and then we went to Jordan. Also, very good presentation about the impact and what is being taken place there in Jordan to combat this effect of COVID-19 on tourism industry in Jordan. And then we went to Malaysia to have a very good presentation about digital or sustainable digital economies and how the efforts or the proposed framework for the Islamic Development Bank countries, member countries, which involve countries from Middle East, Africa, Arab, and Asian. Now we're going to go to our session 2, and I'm very pleased, very grateful to all the people who are behind. You see me, but there's so many people working as we speak. It's a big team, Ashraf, Dr. Iman and their teams, and also Mervin here, Jenny. There's so many people. I'm just in the front of the screen. Now we're going to a very important session, and we have 3 papers, one from United Arab Emirates, and one from Nigeria, and one from Sudan. We're going to start with the first paper, which is Coronavirus 2020, the role of individuals in the United Arab Emirates in the implementation of the SDG Agenda after the pandemic. I think this is really what we have been talking about yesterday when I did my introduction, and I said, we need to think about post-COVID. We spent 7 months now, 8 months, and we expected at least another 6 months just to see where we're going to. Because our Prime Minister said he's hoping, our Prime Minister here in the UK, by Christmas time, we will be able to go back to normality. That's what he's hoping now. And in doing so, and other countries are, I'm sure, doing the same, all of them are in different stages of recovery. But we are facing, last night also, there were very good news about the development in the vaccine from Oxford University and others. And they said there are 23 vaccine initiatives across the world, in France, in Germany, in the US, in many countries. Now, this paper is really, or this presentation we're going to start with, is very important because the role of individuals, because what we have tried to emphasize yesterday, and also we had that public health expert, she said it's not about health. There is a big role for the society, for the community, and we have done that. We have one of the workshops at Queen Mary University about by Professor Farida. She said about community engagement. So there's a big role for individuals. Dr. Kafafi yesterday from New Zealand said, we asked her how New Zealand managed to overcome the crisis, and she said solidarity and people respect each other, teamwork. So I would like to introduce Dr. Muhra Rashed Al-Muhairi from Abu Dhabi government, advisor for Abu Dhabi government. Dr. Muhra, are you ready to start your presentation?
Yes, thank you. I'm here.
Excellent. Thank you very much, and the floor is yours. As I said, all the CV, the biography, all these people are on our website, but I do big few things. I mean, what I always, because we do, we have to say this every time. We have been working very closely with the United Nations, and the United Nations is taking women empowerment very seriously. And whenever we come across a women leader in her localities or internationally, like you, Dr. Muhra, we will feel very proud because this is really what we are really keen. And I'm very pleased. We had 2 women in the morning, and now we have 2 women in these sessions. The more we have women dominating in our sessions, we'll be very happy. She got a PhD, Doctor of Business Administration from UAE University. She has studied, I think, when I looked into your bio, you have, mashallah, many qualifications. She's a senior staff and advisor to the government of UAE. So the floor is yours, Dr. Muhra.
I am sharing the slide. Is everyone, can you see?
We can see the slides, we can see you, and we can listen or hear you. Go ahead.
Perfect. So Thank you for having me today, and I hope I'm so excited to be part of this intellectual conference that will bring the truth about what is happening during and after the COVID-19 for the whole world, hopefully, inshallah. Assalamu alaikum wa rahmatullahi wa barakatuh. And so the paper is about the coronavirus 2019, the role of individuals in the UAE in the implementation of SDG Agenda 2030 after the pandemic. I was thinking about this research for a long time, since the start of this pandemic, and then I'm hoping how the society and individual will be working. So just a few information about myself. I do have a doctorate of business administration. I did, as you said, I worked in mostly education industry and learning and development industry for both federal and local government of Abu Dhabi. And I am very enthusiastic mostly about the research on the social as well as self-leadership, and how can individuals contribute onto the society in general, and how what is their roles. I do have a blog that encourage people and inspire them to be the best version of themselves. So this is a little bit about me that I thought I would introduce it before introducing the paper itself. As you might know, the Sustainable Development Goals, which is the basis of the Agenda 2030, is a blueprint for that has been established to realize a sustainable and better future for all. And SDG are aimed at addressing the global challenges being forced in people, different communities. Those goals include, and we will go through it later, the poverty, zero hunger, good health, and others. And so if we think about COVID-19 is more than a health crisis, honestly. A majority because of it's focusing also the effect on the economy itself, and the impact of economy for everyone. And it is going to make decisions for leaders that need to be guided, and on all the countries that will be affected in different ways. So let's say as of today, how is the UAE in terms of the numbers of coronavirus? And the total cases is around 57,000, and the recovered is 49. And the current case, new case as of today is 271, and the recovered is 352. Thank God for a while, the number of new cases in UAE is less than the number of the recovered. So I think the UAE is going on the right curve with all the precautions that the leaders have been given. And the number of tests and the all the rules and regulation that's been given for society and people who are living in UAE, whether they are resident or they are local. If you might know, UAE locals are only 19, or I think it's 15% of the population. So most of the population are non-locals. However, it's been all the rules and regulations that's been given about COVID-19, it was affecting everyone in the pandemic itself. So let's dig deep a little bit into the objectives of this research. This research can bring other research upward, of course. The objectives is this research was carried out to identify the particular steps that different stakeholders across the UAE can adopt to ensure the SDG are realized by 2030. So we've been, I had some individuals that I interviewed, and those people are on a high executive positions, and they are local and non-local, and they are both thinking about how would the United Arab Emirates, as is this case with the rest of the world, is dealing with COVID-19 crisis. And the lives being lost, of the livelihoods being made uncertain for, or no doubt, immeasurable, and how the UAE, together with other governments and globally, participate on this dilemma. So even there is a lot of connection with UAE and the World Health Organization and recent activities about how the UAE can also help other countries, neighboring countries that in need. And we will cover that later on in the presentation. So the research design was basically an interview covering all the 17 goals. As I mentioned, it's a one-to-one interviews that took place with some executives working on government and private in the UAE. And the questions is how would this goal, identifying the goal of the SDG, all of them, the 17, will be affected by the pandemic from their point of view, from their industry point of view, and from the UAE perspectives and the world perspectives. So some of the interviews brought other curiosity of the questions that we can add also and investigate later on. So the best way to do this research was to do the interview. I managed to do 10 of them, as I mentioned before. So for the most of the finding I am presenting today is regarding each code and highlighting the most important finding. And when I talk about with the individuals, they are thinking about the perspective of the goals. For example, let's take the first one, and probability in all its forms everywhere, and how that will be affected on the after the coronavirus. So, and regarding the first goal, which is need for all forms and poverty to be ended everywhere, 70% of the participants agreed that the importance of UAE leaders to work toward reduction of poverty and certain increase, because it's the matter of which COVID-19 pandemic has impacted different sectors. So internally in UAE, there was a lot of resource and extra resource was given. However, it's also helping other countries, because whatever happening with the neighboring and the all countries around would also affect whatever happening inside a country itself. For example, in this case, it's UAE. Then we have the end hunger, which is the second goal. So, in regarding the second SDG goal, and that is the management of hunger and making sure that all citizens are food secure. 80% of the participants agreed that UAE could provide food to its citizens because it is a recent past. In the recent past, it had demonstrated interest to engaging on a suitable architectural practice. So even with the architecture is very hard in UAE, however, it's been having a new technology to help plantation of some of the farming in the UAE. So UAE is trying to have a focus on that. However, some segment of the participants raised concern about the weather and the climate of the UAE that can be difficult, which can be against some of the plantations and agriculture process. For that, for example, now we are in the summer, it's around 45 degrees. It is extremely hard for the plants to receive. However, there is some local plants that is coming only in the summer, like dates and mangoes and other points. So that's I think what the technology with the Minister of Agriculture is coming up. There is a lot of potential in this term. In regarding the third, which is can be the most important and directly related to the COVID-19, which is ensure a healthy lives and promote well-being for all at all ages. UAE is in a position to effectively roll out health promotion activities aimed at making sure that it is citizens of all ages stay healthy. And the Ministry of Health is working very hard on this, not even to think about the health itself, but preventing anything. And they are having with the preparation of COVID-19, building extra hospitals, managing the current cases, and putting new regulations onto locals and citizens. And they are also, the UAE, as you might see in the picture, it shows that UAE also sponsoring needy country on health crisis. For example, this package was going to Kazakhstan on July 2020, that is this month. And recently I heard that it's been sending other packages to Sudan recently. I think I read this in the newspaper 2 days ago. So it's UAE try to also help other countries to win this battle against the COVID-19. On the fourth, which is goals, which is ensure inclusive and equality of education and promote lifelong learning opportunity for all. The participants stress that the UAE should continue investing in the development of educational facility even after the pandemic, because education, honestly, it seems for some of the participants, is a key source of even covering whatever the pandemic can bring to us. And it can be a long term, but however, it can be the right path for the UAE. That's because of the role of the quality learning has on youth who are relied upon to ensure that the future will be guaranteed. If you might know, most of the population of UAE are from the youth group. So focusing on the youth as well in terms of education and other goals also will be beneficial if there is any focus, and that is the education. The UAE has been partnering with other top universities, for example, to bring them and on board for the learning and development for its local and citizen as well, both the same. And regarding the fifth goals, achieving gender equality and empower all women and girls. Gender equality, where the participants stress that there is a need for the UAE to continue empowering females, as has been done on the recent past. If you know, the UAE has the highest number of minister women in their board. So it is really trying to participate and having even we have the youngest minister, Her Excellency Salma, is a woman who is leading a whole minister with the age than less than 25 years old. The participant further warned that the steps that have been made so far should not be eroded because of the pandemic. So we should not step back onto how we see the importance of the gender, because we are achieving other or winning on other other countries and developing countries, not in, in this goals as well. So, and regarding the 6 goals, ensure availability and sustainable management of water and sanitation for all. So 100% of the participants appreciated the step that have been adopted by the UAE so far to ensure the water is available for its citizens. And that is not an easy for a country that's in the desert. So there have been a lot of process made and regulation made to ensure that part is, and I would believe, and even the participants believe that this is 100% important in all terms. So regarding making sure that all citizens have access to sustainable forms of energy, the participant insisted that this should not be a problem for the UAE, but that members of the public need to be educated on some of the ways through which they can use the available forms of energy more effectively. So probably more education on the sustainable of energy source can be beneficial at this stage after the pandemic. That is very true. And regarding the 8 goals, the observation was similar when it comes to the 8 sustainable goals development, where the participants acknowledge that indeed the UAE is often warm and welcoming to all, and that it should continue providing resources for individuals to be creative and innovative, thereby enhancing their possibility of success. So there is a lot of growth, there is an opportunity still open for citizen and local to open their own small business or big business. At the same time, there is a support for learning and development for them. There was many seats given for local and non-local to learn more so they can affect potentially for the growth of the economy in general, which is I would say the second most affected sector is economy after the health in regarding the pandemic itself. If we go to the goal number 9, all participants similarly pointed out that UAE has made considerable progress in regarding to developing its infrastructure over the previous decade, and that should continue doing even as it's planned to recover from the pandemic. This is because infrastructure provides the platform for innovation to take place, which will be essential in boosting the nation economy. The infrastructure, or in all terms, it's not only the building itself, but even the thought of the infrastructure. Look at the Hope, which is the rocket that went to Mars yesterday or the day before. So that is the thoughts and the development that we want all nation to think about, that is nothing impossible and it's also possible as well. And regarding to goals number 10, the argument was similar in regarding to reduction of inequity across other nations, where the participants appreciated the effort that has been applied by the UAE to support other countries across the world. However, they stressed that considerable effort still need to be applied to make sure that Asia and other Middle East nations view each other with respect instead of initiating conflict with each other. I still remember this conversation with one of the participants in the interview, and the importance of the collaboration between different countries in order to create a better result after the pandemic is the only solution. because you can't just be at yourself. You have to be together. And that was the words that I got from the participant who was talking the other day about it. And regarding the 11th and 12th goals, which is the participant further stressed that UAE can still apply approaches to make sure that the cities and settlements are safe and resilient for all, while at the same time encouraging its citizens to consume healthy product and service. This picture I took from the picture that was announcing that Abu Dhabi, one of the most safest cities in the world, and we don't want only Abu Dhabi to be so. We want all cities to be also in this place. And when we encourage a sustainable consumptions for all citizens, it will have a better views for all cities and the human settlements. And regarding the 13th and 14th goals, taking urgent action to combat climate change and its impact, and also conservation and sustainability use of ocean, seas, and marine resources. Although it is very challenging at the UAE, all the participants similarly pointing out that the UAE has made considerable progress in regarding the climate change and sustainable project seas and marine resources. We have in the UAE the Ministry of Climate Change and Environment, which overlook all the projects that concern the environment, climate change, any marine and any other environmental areas. At the same time, we have Abu Dhabi environment agencies that also look down onto those elements. According to the participant, none of this will be changed because we are living on the climate that is changing regularly, and it is very important to keep up this process and regulation even outside after the pandemic. And regarding the last goals, 3 goals, the participant, it's about protect and restore, promote sustainable use of transnational ecosystems, sustainability, and the forest as well, promote peaceful and inclusive settles and sustainable development, provide access to justice for all, build effective accommodation, strengthen the means of implementation, and revitalize the global partnership for sustainable development. The participants encourage the need for the country to continue taking action aimed to verifying all the elements and regarding those goals, specifically on the sustainability and the peaceful. There is a lot of peaceful argument that's been the UAE been going through, and it's all aimed to having a better peaceful argument with other nearby countries and peace for the whole world as well. So if we think about it at the end,
Dr. Muhra, the time is getting very close. If you can conclude, I will be grateful.
Yes, this is my last.
Excellent. Go ahead.
It's about the value of what this paper can give for the next research. So, given the exist of the damage of the economy, leaders and nation can opt and focus on essential aspects of regarding the recovery. And the argument above reaffirmed that despite the challenge being faced, there is a need for leaders to still be committed to realization of the SDG. And with approximately half of the globe workforce at risk of losing their job due to frozen economy and growth, there is a risk of some goals being revised or ignored. The SDG are important because they provide a clear compass of the direction that should be taken in regarding the recovery process. The SDG will further ensure that no parts of society is left unattended to, for all essential aspects will need to be taken care of. Taking resources away from SDG is likely to be destroyed and will reverse the progress that has been regarded over recent years. Given the role it plays in geopolitics, UAE stakeholders need to work with external agencies such as UNDP with the aim of making sure that the set objectives are realized. Those are the main values that we can take away from here and bring it further for the SDG community as well as the world community and regarding the after the pandemic. By this, I finished and spent 25 minutes, sorry about that. I finished, so I'm gonna stop sharing here.
Okay, that's fine. Thank you very much, Dr. Muhra. Thank you very much. Can I ask, because I think I can see the other speakers are also available to start anytime. Any question for this wonderful presentation? And I think it's also important paper in terms of setting out there is a great and important strategic role for the individuals, because this kind of task is really need everyone to pull their weight, because otherwise you can't get this sorted out. If there is any question, any burning question from any of the followers, any question? Any question to Dr. Muhra before we go to the other papers? Because if you remember my introduction yesterday, we talked about a multidisciplinary approach to address issues to do with sustainability. We said that everyone can play a part, or they must play a part, political science, education, and also we are here about partnership. I mean, Dr. Muhra, thank you very, very much. So stay with us. Let's bring the other speakers and then we will continue. Dr. Muhra, I think if you could kindly pass over the host. I think you already been made the host, I think, because technical. You have been made the host, I think, because of technique. But if you can pass on that to me, and I would like to introduce the second paper, which is follow up very nicely on Dr. Muhra's paper about stakeholder engagement. So we have just looked at the issues of individual responsibility. Now we're going to another paper, another dimension, another perspective from Nigeria. And the paper is co-authored by two authors. So I'm not sure who is going to present. Is it Sunday Oladeji or is it Salami Michael? Which I think you're both here now. Who is going to present on behalf of the team?
Sunday.
Is it you? Sunday. Okay, so Sunday, very warm welcome and thank you very much for joining us from Nigeria. And also, we are very grateful for your contribution. I think you're going to add great value to what the paper just being presented about the stakeholder engagement. So now the floor is yours. You can start sharing the screen, but also please introduce and also details about your co-authors.
So I want to make presentation on the multi-stakeholder partnership and voluntary commitment toward tackling COVID-19 pandemic, NGO perspective. Coronavirus, there are viruses that circulate among animals, but some of them are known to affect humans as well. According to Thomas 20, he discovered an acute respiratory called the coronavirus in Wuhan in December 2019. And by mid-2020, the outbreak has been recorded in some countries, 21 or 210 countries. And by the end of April 2020, over 20 African nations have been able to test positive for COVID-19. For this study, this is the approach that we use, the method that we use. I'm president of an organization in Netlink Environmental Conservation Organization, and I'm also the coordinator of Environmental Conservation Club and Environmental Conservation Volunteer. So what I did was that immediately we noticed this COVID-19 was reported, we started a webinar Zoom meeting, and we used to meet every two weeks. So by May, we have been able to host 8 Zoom meetings on different topics, but it's basically on COVID-19. So I used to be the moderator as the president and coordinator of this ECC, and that's the method we use. So we have 8 Zoom meetings, and you can see the ID on the screen. So as I told you that we have 8 Zoom meetings. On each of the Zoom meeting, we discuss issues, but all the issues are centered on COVID-19, but they are very, very related. For instance, these are the topics that we discuss. We discuss about the introduction of coronavirus and symptoms. The first time we started that Zoom meeting, we asked the participants to tell us what is the knowledge that they have about this coronavirus. So many of them, they share their knowledge with us on coronavirus symptoms and whatever. Then also there was a time we also had another Zoom meeting. So what are the preventive methods that you are using in your different communities? And many of them told us preventive method. Some also told us what we can call tradomedical precautionary methods. That means the use of herbs to build their immunity. Then in one of the meetings also, we had a discussion there. What are the current information about COVID-19? How is it prevalence of countries? Because our participants used to cut across people from different countries, although mostly in Nigeria and in Africa. So we asked the participants to tell us what have been your view, what have been the prevalence of this, what have been your perceptions, what have been the precautionary measures that you take into considerations. Then in one of the meetings, we did a kind of appraisal. We asked our participants from different disciplines. You from agriculture, how do you feel the impact? What's your appraisal? What's your opinion about it? You in the area of tourism, how do you feel it? So we have various view. We have view of various participants, and all these things were documented. Then, in one of the meetings, we agree that can we create a kind of model, and that model we call it integrated inclusive awareness model. In other words, we felt that there should be a way to tell people to create awareness about this COVID-19. Then also, we also did one meeting where we discussed about the efficacy of restriction order, because we believe that in so many parts of the world, the restriction order begin to have impact, either negative or positive. So we asked participants to come forward and tell us in what way is the restriction order affecting you. If it's affecting you positively, you tell us. If it's affecting you negatively, you tell us. And so we look at the efficacy of the restriction order in different parts of the world among our participants. Then the last discussion that we had was the youth participation in combating the spread of COVID-19. Here we allow the youth among our participants to tell us how or what can we do. How can youth participate in combating the spread of this COVID-19? So this is our discussion. And this discussion is summarized this way. 1, we have the preventive measures. And these preventive measures, we try to categorize into 3. We have personal hygiene, we have environmental hygiene, we have food hygiene. Under personal hygiene, people tell us that, yes, you need to use nose masks, you need to wash your hands, you need to make sure you clean your body, make sure you have a personal hygiene, wash your hand, use sanitizer, use soap. Then people also tell us about environmental hygiene. In that wise, you have to keep your environment very clean, because we believe that these viruses, environment, a dirty environment could also serve as habitat for these viruses. Then we have food hygiene. So that is food hygiene. Participants, they told us that yes, food hygiene is another way to cut the spread of this COVID-19, make sure you eat your food warm. You cannot eat it hot, but don't eat cold food. And make sure you eat fruit, vegetable, things that can help to boost your immunity. That's all those things that we documented under the food hygiene. Then the other aspect that we also look at is what we call precautionary method. And under that precautionary method, we call it tradomedical, because we find out that mostly people, they are using traditional medicine to build, to do a kind of precaution. You know, under precaution, we know that is maybe you are feeling sick, you are having symptoms of malaria, or you have symptoms of a headache. So what could you do? And that's what we knew that by precaution. So, you know, coronavirus has stages. One, they say it starts with sneezing. After sneezing, you feel sore throat. After sore throat, you have headache. After headache, you begin to have a temperature and all that. So at this point, there's what we call tradomedical precaution methods. So what could you do at this point? And that's we now find that many people, they are resolved to using traditional medicine. So these are the traditional medicine that were documented. We have boiled leaves, Morinda lucida, we call it in my own local language, and we have Asadrata indica, then we call it dogoyaro in my own language. So what people do is that to build their immunity, when they are feeling sick, what can they do? You know, the preventive measure is, this is what you can do to prevent it. But now, precaution is, you now find out that you have symptoms, not COVID-19, because none of our participants is COVID-19 positive, but they are just telling us that this is what you could do. So under that, we have using leaves. The other one is the food consumption. So many of them, they said that yes, there are some kind of food that they now taking for them to boost their immunity. And under that food, we have different kind of fruit. We have orange, we have tangerine, we have mango, and we also noticed that they told us that the COVID virus, the virus called COVID-19 virus, is more or less the pH is high. So we need to eat fruit that has a very low pH. So by that, we're able to have a balance of the. So then, what are the results that we gain from all these discussions? We have introduction on coronavirus. People tell us about symptoms, and we find out that people are very, very knowledgeable about this coronavirus because they told us some things, some from literature, from what they have read. Then they told us about preventive and traditional medical methods of containing the spread of COVID-19, just as I've told you in our discussion. Then the current information on COVID-19 prevalence across some countries or participants. They told us so many things. Their perception, some are saying that the number is increasing in their countries. Some said the number is they gave us, some will tell us what is happening in their community. And they tell us the different ways they are preventing it. But in preventive method, let me tell us that most of the participants, they are so much into personal hygiene. Personal hygiene. Many of them, they wash their hands. Many of them, they wash their hands. So many of them, they told us that they wash their hands, they do all manner of things. Then, appraisal of the impact on the COVID-19 outbreak across the world. So we have environmental impact, and as I told you that during this appraisal, we have people from various fields. We have those people from the area of environment, we have those people in the area of tourism, we have people from the area of agriculture. For those people in the area of environment, they say yes. The area of ecology, mostly, they say yes. The anthropogenic activities on biodiversity has reduced because most of these fauna, most of these animals, they are already in the wild. We find that many of them are already moving toward the city because there is little disturbance on them. Then in the area of low, they also notice that there is a low emission of carbon because most of the time people don't use vehicle. There is vehicular movement is restricted. Then on the area of tourism, those people in tourism, they said they are experiencing low customer patronage, because many people are not traveling. Some people are not even going for shopping because of the COVID-19 outbreak. Then in the area of agriculture, people are saying that there's scarcity of food because many people are not allowed to go to farm. People are restricted from going to market. So, and participants are saying that except we urgently do something, that this COVID-19 care is not taking, it might lead to scarcity of food, except the whole world can quickly do something to make sure that we go back to farm and we make sure that we involve in agriculture. Then the other discussion, which of course is part of our result, we developed this concept, this model, and this model is shared. We have the soft copy, the soft of it. So we social media, we share it everywhere. We develop this by ourselves. The symptoms, the prevention, COVID-19 awareness. You can see that, you see the logo of the organization on it. So we branded it, then we share on our social media, on our mass media. Then the participant also suggested that we should go house to house. We should do what we call house to house street campaign. That we should also do what we call mass media. We should go to press, we should go to radio, television, and let people know that these are the symptoms, these are the prevention methods. So by this now, we're able to generate and we're able to create awareness. So in conclusion, in view of the outbreak of COVID-19 and attendant challenges, there is need for all the stakeholders to work together to fight against this pandemic that is ravaging our world with concerted efforts. Our NGOs, we have done our own part. We will continue to do it. We are having Zoom meetings to sensitize people about this virus and how they can prevent and how they can do a kind of precaution method. So we are also employing other NGOs to join hands with us. Let us have a cogent role. We have cogent role to play in collating, in disseminating information among the populace, using all available platforms. Thank you.
So fine, let me now introduce the third speaker for today, which is also a joint paper by two speakers, Dr. Salma and Dr. Idris. You will introduce our speaker, her co-speaker. Dr. Salma is from the, she's an academics from the University of Science and Technology in Sudan, and her co-author, she will introduce her co-author. They have been doing quite a lot of good work on sustainability, particularly about cement, sustainable production of cement. She's going to talk to us more technical about one of the, yesterday they talked about the trials. So Dr. Salma, because of the time, I will give you the floor.
Welcome everybody to our presentation. My name is Salma Yahya Mahmoud and my colleague Eltahir Muhairi. We're trying to investigate the behavior of calcined kaolinite clays from Sudan as a sustainable cementitious material. The presentation, I'll cover a brief, I'll give a brief introduction and then state the problem, outlining some of the objectives, and I will give a brief account on the kaolinite clay in Sudan, their origin, structure, and availability. And then I'll focus on the experimental work that we conducted, giving you at the end of the presentation a conclusion and some recommendations. Right, Sudan, the construction industry in Sudan, as in many developing countries, suffers from a multitude of challenges. These challenges confront the development and the performance improvement of the industry. And for the problems related to the materials, the construction materials, construction and building materials, their production, their supply, and their management, this problem tend to dominate the list of impediments towards the industry improvement. So the building construction process basically involves the usage of several materials. Some of them are natural, others are man-made. And because of the appearance of new trends in building architectural and structural designs, more man-made materials came into the scene with more sophisticated properties to match the client's requirements for more durable, cheaper, and ecologically friendly options. Concrete, which is the most widely man-made structural material. It's a composite material that is mainly containing aggregates in their two different forms, the fine and coarse aggregate, as well as cement, water added in different proportions, and maybe sometimes we add some admixtures for certain properties. However, concrete is criticized for being an environmentally unfriendly material. The production of concrete involves the use of cement, and cement production is one of the main problems that for the carbon dioxide emission. The production of cement involves depletion to the natural resources during the process of the raw materials extraction and processing. And also, the concrete transportation consumes energy and poses some pollution to the environment as well. So, this means that the impact of concrete production to the whole environment, it destroys the natural infrastructure without replacing the ecological functions that humanity depend on. So our aim concerning this part of our research is to find environmentally friendly materials, to look for more comparable options, and to look for something that is sustainable, but at the same time could do the same job that the components of the concrete mix can do. So we basically were thinking to go green. Our objectives are as follows. We wanted to explore the availability of kaolinite clays as a naturally occurring mineral in Sudan, and wanted to prepare metakaolin, which is a thermally treated form of the kaolinite clay. And we wanted to determine the chemical composition of this metakaolin and to assess their pozzolanic reactivity, because we're going to use them in replacement for cement in different types of concrete mixtures, so that we can determine whether it's a suitable material or not. So the methodology that we basically adopted was as follows. The kaolinite clay was collected from 4 different locations in Sudan for this study. And after that, we transformed the kaolin clay to metakaolin through a calcination process. Then we checked the chemical composition to determine the major oxides which were available in this form of material, and compare that to ordinary Portland cement. As well, we wanted to determine the degree of pozzolanicity for this new material before using that in different ways in concrete mixtures. As for the kaolinite clay collection, the kaolin, which is the China clay, it's a hydrated aluminum silicate crystalline mineral, which is called or referred to as kaolinite. Its physical appearance, when we collected these samples from the field, it's just like sometimes it's a powder, other times it gets in like larger pieces, whitish in color in some places, and in other places the color is brownish, light brown, or maybe yellowish or grayish. All in all, it does not dissolve in water, but when it gets wet, it gets darker in color and it gets an earthy smell. Chemically, the kaolinite clays are structured around a series of alternating buckled silicate and aluminate layers, with the silicon in 4 coordination and the aluminium in a mixture of 5, 4, or 6 coordination. In Sudan, it was found out that kaolinite clay is available in many different areas, extending all over the country. We've got samples of kaolinite clays in the Red Sea Hills in the northern Sudan. We've got some in northern Kordofan in the western part of Sudan. We've got some in the northern parts of Sudan, in Shendi. We've got in Gadarif, Shuak, even in the central parts of Sudan. So it's available in many locations in Sudan. The process of getting the metakaolin, which is the material that we are going to incorporate in our concrete mixtures, we had to treat the kaolinite clay in a thermal way. So it's a very simple and basic process where the mineral kaolinite was heated. Upon heating, this process drives the water up and collapsing the material structure. The ending result is an amorphous aluminosilicate, which is the metakaolin that we are trying to use in our concrete mixtures. Right. For us in the lab, the kaolinite clays were heated for 5 hours in temperatures ranging from 700 to 800 degrees Celsius in a very simple furnace in the lab. And after that, the process was followed by grinding it in high capacity mills to produce very fine particles, because basically we are trying to mimic the fineness of cement in our concrete mixtures. As for the obtained sample of the metakaolin, we had to check the chemical composition of the material by determining the oxides present in our samples. So we were focusing on the major oxides because we're trying to compare that to ordinary Portland cement. So the samples obtained from 4 different locations, Marawi, Kassala, Gerri, As-Sayyal in Sudan. We had the analysis, and then that was compared to the major oxide, considering 3 different standards: the Sudanese manufacturers, and the limits according to the ASTM, as well as the limits according to the British standard. On top of this, we had to check the pozzolanicity and the limit according to the limit set by the ASTM C618. So what we found out is that the kaolinite clay are very rich in oxides that are of interest to us when we study cement. So after checking the suitability of the produced or the calcined kaolinite clay in comparison to ordinary Portland cement, we wanted to use that in our concrete mixture. So 3 suggested scenarios were explored to visualize the possible outcomes. We had the metakaolin to produce normal concrete, and once again to produce high strength concrete, and then producing self-compacting concrete. So with the first scenario, the metakaolin was added in concrete mixtures in different percentages. We started with 5, and then topping it up to 10, 15, 20, and 30% in replacement for cement. Right, and we checked after that the compressive strength. We checked the compressive strength for the different samples in different curing ages. As for the first sample, we had it for 7 days, 28 days, and even we studied the long-term effect of this material in our mix. And we were able to get results exceeding the targeted strength for the first sample. As for the second sample, or the first design, we had 7, 14, and 28 days, and we were also able to get compressive strength, which is matching the required or even getting higher than the targeted strength. The same applied for the last sample from another location, and it gave us the same results. For the second scenario, incorporating metakaolin to partially replace cement to produce self-compacting concrete, 3 mixed trials were conducted, where the first trial was not successful. And for the second and third trials, we were able to get self-compacted concrete. We had the fresh concrete test for the slump flow, for the V-funnel test, and then for the viscosity test, as well as the hardened concrete properties. We checked the compressive strength. So for the third scenario, we had the metakaolin partially replacing cement, but this time producing high strength concrete. So we had all the fresh concrete tests as well as the hardened concrete test. For the fresh concrete test, the results were within the required set limits, and for the compressive strength for the hardened concrete samples, we were able to get the compressive strength in the range of 53 to 63 megapascal, and by that exceeding even the targeted strength. So what can we say out of all these experimental work and experimental results? The kaolinite clays are abundant, and they are present in different locations in Sudan. And that makes it one of the most important aspects. The other thing is that the chemical characterization of the metakaolin showed us the presence of high amounts of silica, alumina, and iron oxides. The percentages are even exceeding the limit set for cement by the 3 standards that we consulted. And these are the major oxides that we are looking for. At this point, we were very happy with these amounts, and we were expecting good results, as these are early indications for the suitability of this material. Also, we found out that the presence of magnesium oxide and the loss on ignition values were all within the set limits for all the consulted standards. It was also evident the possibility of producing normal concrete, high strength concrete, and self-compacting concrete. The three forms or the three scenarios that we investigated, we were able to get good results out of this, out of the use of the metakaolin. We found out that the location from which we got the source kaolinite clay makes a difference. For example, Casalas metakaolin yielded the targeted strength in 28 days with an optimum amount of only 5% of metakaolin replacing cement, while from another location, which is Gary, the metakaolin yielded just a slightly higher than the targeted strength with the same amount of metakaolin replacing cement. And when we had the metakaolin included in self-compacted mixtures, that was interesting. All the slump flow test results confirmed the suitability for the different types of structures being slightly reinforced for vertical application, for normal application, while the other test, which is the viscosity measurement, showed a medium rate flow, whereas the 28 days compressive strength had further confirmed that the trial mixtures meet the targeted value. It was also possible to achieve high strength values, values for the concrete that included metakaolin, and we got up to 63 megapascal when metakaolin was included in the range of 10 to 20 in replacement for cement. So what can we say out of our results or our experimental work? Because we had so many samples, different ages, different metakaolin from different locations. We had the metakaolin processed at different temperatures. So we had a lot of experimental work, and all these results gave us reasonable evidence for the usefulness of this material to be a sustainable cementitious material, because at one hand, it gives us the required properties that we need in our concrete. And at the same time, it's just like, it's an available, abundant, it doesn't really need chemical treatment or processing, or it does not deplete the virgin, the environment. So we're not harming the environment. We are getting what we want for the concrete that we are producing. So we were quite happy with this material to be used for concrete as a cementitious material. And I think we've got, we've got more and more experimental work on it to have it like in different types or more types of concrete and studying it at longer ages. But the results until this point gave us very reasonable evidence that this could be one of the sustainable construction materials. Thank you very much for your attention.
Thank you very much, Dr. Salma. Now let's open the question. Let's open it for question and answer now. Hello? Yes, Dr. Ahmed Al-Khabouri, go ahead. Yes.
Yeah, my question is for Sunday. He suggested that he can go house to house for awareness for people in terms of COVID-19 and something. Is it an effective way, because people during this time just avoid seeing people and to come to their houses or something like this? Is there any other methodology which more effective? Thank you.
Okay, Sunday. Thank you, Dr. Ahmed Sesia. Yes, Sunday, did you hear that question?
Yes, I can hear the question.
Yeah, go ahead, answer it, please.
As I've told you that we develop a model, we call it integrated inclusive model. What do we mean by integrated inclusive model? Part of it is that we want the youth to take active role. And how do you expect youth to take active role? This time around, we don't allow people to gather together. That does not mean that you cannot move from one place, from one house to the other. The fact is that you cannot gather. So you could leave your house, move to the next house. Of course, the fact is that you can educate that house. When you say you don't, the COVID-19, what this is that social distancing. They are not saying that you could not go. But of course, if you get there, as far as you maintain that social distance, you are covered. For example, if you come to my house now, and you say you want to and you stay at my door, you tell me that you want to tell me something about COVID-19. In as much as you maintain that distance, I will listen to you. The only thing that you cannot come into my house directly. Of course, even if you want to come to my house, as far as you wash your hands, you use sanitizer, you cover, you use nose mask, you can interact to some extent. Oh, you get me? Dr. Ahmed.
Yes, we're hearing you.
Okay, yeah. So the model means integrated. The model say inclusive model, participatory model. Integrated in the sense that it is not only police, it is not only army. It involves everybody. It involves those people in the area of agriculture, those in the area of environment, those in the area of wildlife, those in the social scientists. All of us, we need to work together. If you notice in many African countries, they are using arm, they are using army, using police to chase people. No, that is not the best way approach. If you look at United WHO, they develop what we call one concept approach. One concept approach means all of us, we need to work together. So what we are saying is that you can go from one house to the other in as much as you are not having a close contact. You understand? You maintain social distance in whatever that you are doing. So when you maintain social distance, move from one place to another, move from one street to another, and don't go in group. You can go alone. You understand? So there is nothing stopping us from moving from one place to the other. The only thing is that make sure you maintain social distance. Thank you very much. Yes.
Okay, that's fine. Thank you very much. Any other question? If you can just maybe raise your hand or press that red yellow hand, I will give you the opportunity. Any question? Now, because I've been following this on the social media, by the way, there's a very good coverage in the social media. Now, Dr. Salma, let me just unmute you first to make sure. Can you unmute yourself? Yes. Dr. Salma, the question we always ask with all technology, all new approaches, all new applications for the production of any kind of products, chemicals, whatever we do, on the sustainability, we ask about the economic and social visibility. To what extent socially and economically, because many people, engineers can understand your engineering discussion on the paper very well, but for those from the social science, they will be very keen on two things. How visible this, I know you have explained that in the paper to some extent, but if you can just give people in economic terms, do you think that's going to be, like, just give you an example, like wheat production. Wheat is where we get our bread, we need wheat. But many people, scientists, have been working quite closely to minimize the usage of wheat in the making of bread to try to get maize and other kind of grains. So that means you can, because you need to make sure it is still have that glue factor, but at the same time, it is economically visible. To what extent what you're proposing is economically going to work? Let's assume you succeeded in all your experiment eventually, and we want to apply it. Maybe the industry sector, they will say to you, is good, doctor, but it's not visible. We're not going to get money from it. The same like renewable and green energy and all these things. They are in the UK, they're expensive. Green energy is not cheap. To change this house into solar and green, it can work, but that's why the government is paying money as a grant for people. So in your case, is it going to be economically feasible?
Well, this is one of the most important things, is to see the economics of the whole concept. But we were not able to get you an exact figure because the way we treated the clay, to be able to use it to substitute cement, we were using very basic equipment to produce that. So even if we were going to calculate the cost for that, it's not going to give us the exact or true value, because if we want to use the metakaolin in large scale to replace cement, we have to prepare the metakaolin and produce it like the cement. So we will have like maybe if we're producing large amounts, then we're not getting very expensive products, like the concept of the economy of the scale or so. But because we are doing it in very small amounts now, the costs that we are calculating are not the true ones, because we had to go somewhere to make the calcination process, and that will add to the cost because we pay for that in a different way. We have to get the raw material itself is not costly. It's just abundant, it's everywhere. We just go and collect it. So this is not costly at all. But we didn't really get exact figures calculated to let you know that the cost of using metakaolin is going to be X, while the corresponding cost in case of using cement is going to be X. Because the cement is a well-known process and we can calculate that, or we have the figures. But for the metakaolin, we don't really have the figures yet, to be honest.
Thank you very much, Dr. Salma. But the important thing, you are a scientist or an engineer, you're taking that into account, because this is what we always try to make sure. When people work in multidisciplinary team, we say it's important, we bring this to you. We are economists, you are a scientist, you are engineer. So yes, we want to take care of because we don't want to end up in a result, producing good result, but people, they will say to you, it's very expensive. Now, if there is any other final question, because we're really running out of time on this session, apologies for these technical issues, but at least we managed to get all the three presentations. The good thing is all this presentation, Mervin and his team, they will edit them and they will make them, and they will we will then be able to customize them, and they will be shown on a separate lecture. So you will see them, all of them. If there's any other final question, I'm just trying to look. If there's any, press on that yellow hand if you have any question. I can't see any other question. I think we're slightly over our time. It's almost 1 o'clock. Now we're going to give you a half an hour break. But before we do that, I would like you to join me in thanking all our three distinguished speakers. We had Sunday Oladeji from Nigeria, also Salami, Michael from Nigeria. We had earlier Dr. Muhra from UAE, and we had finally, last not least, Dr. Salma and her co-author from Sudan. If you could all join me in thanking them, I think we have to clap for them because I think they have done a wonderful job. We wish if they were physically here, we can have said thank you to all of them. But it has been a very informative, very useful three presentation. Thank you very much, and I wish you all the best. We will stop for half an hour because we have a lunch break, but we are technically back at 4 o'clock with three very good papers. I think they want to talk about technology. We have, I can quickly just remind you what we have at 4 o'clock. We have Disruptive Technologies, Livelihood and Education by Monica and Larry from the US, the entertainment industry, both COVID-19 in developing countries, developing technologies and new approaches from Nigeria. And then we have a paper about e-learning in accounting education from Libya. And then at 6:30, we have three papers, one from UCL, Impact of COVID on Black and minority ethnic female health care. We have Social Impact of Community Resilience by Olivia. And then we have the impact of COVID-19 on ethnic minorities. So I will leave you now. We'll see you at 4 o'clock. Thank you very much. And please stay safe and adopt this social distancing. All the best.
So please remember, if we all help and do a little bit, it will make a big difference.